I'm Dr. Morgan Macaulay, and we always get loads of questions about implant treatment, so we're going to do some quick fire of our most frequently asked questions.
What exactly is a dental implant and how is it different from a bridge or a denture?
So a dental implant replaces a natural tooth by a titanium root piece, so like a bit of a titanium screw, and then we have a crown or a bridge or a denture, or something goes in on top of that, so screws in on top. So the titanium piece is a bit like the root of a tooth.
Am I a good candidate for implants and what factors determine that, like bone volume or health?
So majority of patients are suitable for implants, but there's a lot of factors that can affect your risk factors and sort of the prognosis of implants. And they're normally down to sort of medical, so are you a smoker, do you have diabetes? And then sort of dentally, the bone quality, bone volume can play a factor in there as well. But once you have a full assessment done, we can really go through your risk factors and how we can tailor the treatment plan to reduce those risks for you.
How long does the implant process take from start to finish, surgery, healing and crown placement?
So this really depends on your treatment plan that you have. It can vary quite dramatically. I mean, ideally what we can do is we take the tooth out, we put an implant in called an immediate implant, and we can put a temporary crown on top of that. And so you are never left with a space. So tooth comes out, implant and a temporary crown goes in. We then have a period for what fancy name for it is osseointegration, where basically the bone heals around the implant, and that normally takes from about 3 months onwards, and that again will depend on if there's been grafting or your mental history as well can play a factor in that. In general, we would say a few months from start to finish.
Will getting implants hurt or require major time off from work or normal life?
Majority of implants we would classify as pain-free. So there is obviously a healing process afterwards, so you can get a little bit of tenderness, a little bit of swelling, a little bit of bruising, but majority of patients are completely fine to go back to work the next day or the day after.
How long do dental implants last and what is their success rate?
So the success rate does depend on the type of treatment that you've had, the grafting, your health as well plays a big factor in that, but they can last decades, and really what comes down to is the care and maintenance and health of the patient.
What are the risks or complications with implant treatment such as infection or bone loss?
So implants are generally a very low risk treatment, but of course there are some small risks such as infection, delayed healing, or the bone not integrating with the implant. The good news is that these are really rare, and with good planning, good hygiene, good aftercare, success rates can be well over 95%.
How should I care for implants after placement? Any special hygiene or diet rules?
Absolutely. So the prognosis, the success rate of implants can come really down to the aftercare and how well you take care of it. So just treating it like a natural tooth, making sure we're keeping it really clean and with your interdentals every day as well, and seeing your therapist or your hygienist every 3 to 6 months.
Can an implant look and feel exactly like a natural tooth?
Most of the time, anyone else can't tell that you've got an implant in. It looks just very much like your natural teeth and blends in seamlessly.
What happens if I don't have enough bone? Will I need bone grafting, and how does that affect timeline or cost? So at your assessment, we would assess your bone quality, bone volume, and discover if there's any discrepancies that might need a little bit of build up, and that would be with some bone grafting material. And with that bone grafting, it can possibly add on a little bit of time to your treatment plan, but a lot of the time it can just be done at the same time as the implant is placed.